All right, let's talk about the latest on the Affordable Health Care Plan. Joining me this morning is health insurance broker Craig Gusson, and we're talking about when it begins and what it means to the majority or not the majority of Californians. It's still confusing at this point, and we're just a couple of weeks away. Good morning to you.
Good morning.
It actually kicks in as far as signing up October 1, right?
Yes.
So what does that mean to the average San Diego County-an?
That means that as of October 1st, you can go and sign up to get a January 1st effective date and get health insurance either through Covered California or through plans outside of Covered California, and it's all going to be guaranteed issue, no medical questions asked at all. However, as of this morning, the rates for all the insurance companies haven't been officially announced.
So we don't even know what it's going to cost.
We don't know. We don't exactly know the plans outside of the exchange. Mm-hmm. Inside the exchange, we have a pretty good idea. But the concern is that a lot of these plans, to keep the cost down, have reduced the network of who you can see in hospitals and doctors. Mm-hmm. One rumor out there is that you can't use Scripps or Sharp for one network. And if that's true, you got to really make sure. So we're recommending to our clients that any individual who's looking at going into the Covered California makes less than $46,000 a year will get a subsidy, but let's wait until mid-October, maybe the end of October. Let's see what all the rates are, the plans are, and let's look what the best thing for you is. Because as long as you sign up before December 14th, you're guaranteed coverage January 1. So we have some time to do it, and I don't want people to rush into it, because the question I ask Covered California is, if I sign up on October 10th, and I decide in November 15th that it's a wrong plan, can I change? And their answer was, we don't know.
You just don't know at this point. You don't know if you can even change. So you're saying, don't do anything October 1st, even though that's the date everybody's been given that you can start.
You know, it's like going to the movies, opening day. Everybody's waiting in line. But here, you can wait. I mean, you can sign up October 1st, but we're not 100% sure what we're going to give you. And if us agents who are getting it for you and helping you don't know about it less than 2 weeks before, you know, we need to digest it and figure out what's out there and what's best for the client and who's your doctor, what, you know, and hospital you use.
When you say client, who are you talking about here? It's a small minority of people, correct?
Correct. But 16% of the population do not have health insurance today. The people that are really going to look at Covered California are people that are going to get subsidies. Mm-hmm. You make less than $46,000 a year, you're going to qualify for a subsidy of anywhere from $2 a month up to over $400 a month.
Right.
What I found out interesting, though, was that if you're 50, 55, 60, you're going to get a much higher subsidy than if you're 20, 25, or 30. And the interesting part was, I was looking at someone making $32,000 a year, and a 25-year-old got a $2 subsidy, and a 60-year-old got a $408 subsidy. So you want to understand the subsidy, and a big key to the subsidy is if you get a pay raise during the year, or if you have a family plan and your wife goes back, or one of the spouses goes to work, that could affect your subsidy, and you have to tell Covered California. If not, they're going to be coming back in December 2015 and want a refund from you. So you really need to be aware of that. You want to work with your agent and make sure that they help you pick the best plan and make sure that the subsidy is based on your actual income and there's no mistakes.
And you say work with your agent. A lot of people out there don't have an agent. Right. How do they go about getting an agent and trusting an agent?
Most agents that sell health insurance belong to the San Diego Association of Health Underwriters and the California Association of Health Underwriters. We're an organization that basically all we do is health insurance, and we're there to help you, support you. We've spent the last year getting educated about healthcare reform, and that's all we're doing. So every insurance company is coming out with what their plans are going to do, and every agent's going to it. I just saw a report the other day, 13,000 agents in California have signed up to be able to work with Covered California, but yet only maybe less than half of them right now are licensed to, or registered to go and be able to do it. So everybody is trying to get ready for October 1. Don't rush into it. Find an agent. If you can't find one, just go to San Diego Association, or I think it's SDAHU or SDAHU.com, and we can refer you to somebody.
What if the individual decides, this is overwhelming, I'm not going to do anything? What happens to those people that fall through the cracks?
If you don't buy health insurance, see, the misnomer is people think, got to buy health insurance. You don't have to buy health insurance. You just pay a $95 fine come sometime in 2015. When you do your tax return, you're going to have to give them a copy of your health insurance ID card. If you don't, your refund that you get is going to be $95 less or 1% of your income. Now, if you're getting a $400 rebate and instead you get $300 back because they take $100 for the fine or the penalty, is it really going to make a difference to you? Probably not. So if you don't get health insurance, you're going to be fined. But here's the thing that nobody gets. Come April 1st, 2014, nobody in America can buy health insurance except if you're joining a new business, a new job, getting hired. If you go on COBRA because you lost benefits, if you get married or have a baby, you can add the spouse. But you can't buy health insurance come April 1st. And when you do be able to buy it, it's going to go effective January 1st, 2015. So you need to do something between now and March 31st.
Okay.
Yeah, I know.
If it's confusing, even the agents that have to go through this education, what do you think this is doing to the public?
It's a lot of questions. I was at a Blue Cross meeting, a 3-hour Blue Cross meeting last week, and we were asking real detailed questions. The answer is we don't know yet. So nobody knows exactly all the details of it, and every day I'm learning new things. And that's why I'm saying wait.
Okay.
Wait till October 15th, wait till October 30th. We have a lot of time.
Let's get you back in here at the end of October, and maybe you can straighten all this out for us.
Hopefully we know a lot more then.
And help our viewers, help the individuals that need to get it, how they go about doing it. Okay?
And you have time. Don't rush into it. And we're here to help you. There's a lot of agents out there that do a really good job and really want everybody to get health insurance. Just spend the time and make the best decision, for you. Because most people will spend more time planning a vacation than they will planning for their health insurance needs. And if you find out next May that you bought the wrong health insurance plan, you can't change.
Okay.
So you need to make sure it's done right.
Greg, thank you very much.
My pleasure.